Have you noticed your tummy getting bigger, or sex has been painful for you? Or worse still, recently you started experiencing heavy menstrual bleeding to the extent that you feel dizzy and weak after each cycle? Well, a number of entities may be responsible for this, but top on the list is the presence of fibroids in the uterus, that is, the womb. In today's video, we'll be talking about the different types of fibroids, how they impact our lives, and how we can get treated. Hello everyone, I'm Wale Olaboboye. I'm a medical doctor and a reproductive health advocate. Welcome to this channel where we discuss everything and anything aimed at improving your health and wellness. In our last video, we had this conversation about how your age can affect your fertility. You can check this out using the link in the comment section below. So let's talk about fibroids, also known as myomas. Fibroids are a common type of benign growth in and on the uterus, that is the womb. They can occur as a single nodule or in clusters and can vary in size from as small as a tiny bean seed to as large as a watermelon. About 6 out of 10 women have fibroids, but the good thing is a lot of these women do not experience any symptoms, so they don't know about the presence of fibroids in their womb. They only get to know when there's a reason to do a scan for other ailments. I'm sure you're wondering, what are the causes of fibroids, or what exactly is responsible for fibroids? Unfortunately, the exact cause of fibroid is not known, but a number of factors have been outlined which we call risk factors. First that I'm going to mention is the fact that you are African. The chances of having fibroids increases. Secondly, one thing that has been implicated is the female hormone estrogen, and this is because fibroids are found commonly during the woman's reproductive years of between 16 to 50 years of age, and this is when the hormone is at its peak. It was also noticed that following menopause, that is when the hormones are no longer there, fibroids begin to shrink. This speaks to the fact that fibroids may be related to the presence of the female hormone estrogen. The next risk factor is being overweight or being obese. Women in this category have a lot of these female hormones flowing in their bodies, and this contributes to the development of fibroids in them. It has also been discovered that women who have had children have a lower risk of having fibroids. In fact, the more the children the woman has, the lesser the risk of having fibroids in a lifetime. You need to know about the types of fibroids, as this knowledge will guide you and your doctors to know the type of treatment that will be beneficial to you. There are various types, but I'm going to talk about the most important type, and the first is the intramural fibroid. This means that the fibroids grow within the muscle wall of the womb. Secondly, we have the subserosal fibroids. Now, these ones grow outside the wall of the womb, and they can actually grow to a very large extent. The next is the submucosal fibroids. These grow within the inner layer of the womb, and this is actually responsible for the heavy menstrual bleeding women experience when they have fibroids. Now that you know the different types of fibroids, I believe that the next time you see a scan report, you can relate well with what is written in it. How do you know that you may be having a fibroid? In other words, what are the symptoms of fibroids? As I said earlier, many women are unaware of fibroids present in their wombs because they do not have any symptoms at all. So in these women, they do not have to worry about a thing. However, 1 in 3 women with fibroids do have symptoms, and when they do have symptoms, they experience any of the following things I'm going to talk about. The first and the most important symptom of fibroid that I will talk about, which I consider the most dangerous, is the presence of heavy menstrual bleeding. In this situation, there is an increase in the amount of blood loss, and also there may be an increase in the duration of flow. The woman may also report passage of blood clots. This whole thing leads to a decrease in our blood levels, which doctors call anemia, and that is what is responsible for the weakness and the dizziness the woman feels. It can be bad that the woman may need blood transfusions. Other symptoms include painful periods, pain in the lower tummy and the back, pain during sexual intercourse, bleeding in between menses, and occasionally the woman may experience constipation and inability to pass urine. Rarely, fibroids may cause infertility or increase the chances of having miscarriages. If you or anyone you know experiences any of the symptoms outlined earlier, do not sit at home. Visit the hospital, talk to a doctor who will ask you a few questions, carry out some simple examinations on you, and request for some tests such as an ultrasound scan. If your scan results then shows that you have fibroids, there's actually nothing to worry about because there are a lot of treatment options available for you. If the fibroids are small and there are no symptoms, then this person does not need any treatment at all. However, if the fibroids are producing symptoms as earlier outlined, this individual will need treatment as soon as possible. Treatment vary from medical options to surgical options, but the mainstay of treatment is surgical. But we are also aware that there's a lot of aversion to surgeries in our environment. There are a number of medical options which makes use of drugs to take care of the symptoms produced by fibroids. Note, these drugs do not treat fibroids. They only take care of the symptoms such as the pains and the heavy periods. I've been asked this question a number of times. The question is about drugs that can shrink fibroids or make fibroids disappear. Well, there are a number of drugs that can help to shrink fibroids, but these drugs are not used as a cure for fibroids. They are mainly used by doctors to shrink the fibroids while preparing for surgery. The fibroids grow back to their previous size as soon as these drugs are stopped. The mainstay of treatment is surgery. Surgery can either be removal of the fibroids or total removal of the womb. Well, removing the womb entirely is only reserved for women who have completed their family size and do not desire to have more children in the future. The truth is, many women have lost their lives to heavy menstrual bleeding resulting from fibroids. You don't have to be part of that statistics. If you or anyone you know has the symptoms earlier outlined, visit the hospital and talk to a doctor and get help as fast as possible. I hope you find this video really informative, and I also know that you've got questions. Drop your questions and comment in the comment section below. I love reading your comments and I'm happy to answer any questions you've got for me. I'll see you in our next video. Till then, stay safe.